Okay, well, I just want to start by asking, I know you work with Dr. Thames. Um,
Hmm.
I was talking with her a little bit before, and she mentioned you were an apprentice to the office. So have you been at the office kind of recently?
Yes, so I joined here in July. So I guess or good afternoon now, I guess. I've been here about 6 months, and then I was at a different
Okay.
practice for 11 years prior to that.
hmm Okay, cool. And Dr. Thames did mention she had used one in the past, an amniotic membrane. Are
Mhm.
you are you familiar with the amniotic membranes?
So I don't have any personal experience. I have been to multiple CEs on it over the
Okay,
years. And then when she was giving me kind of inventory and, overview of the office, she showed me where she had the one here. And so I did watch some YouTube videos that she recommended on
great.
placing, using them, and then some, I think, like extra insights that y'all had told her that it worked for other practitioners.
Mhm.
But I haven't had like actual hands-on experience with it yet.
For sure. All right, yeah, great. Well, getting a little more into it, what kind of patients do you typically see in the practice right now?
I mean, I think like most people, it's a little bit of mix of everything. I mean, the majority of our office is obviously routine glasses and contact lenses. But
hmm
we've already had two medical office visits this morning from things from the weekend. So we do see a lot of dry eye, a lot of ocular surface issues, a lot of glaucoma.
All
So it
right.
just kind of runs the gamut. Like it's a pretty even mixture. We are kind of right on the outskirt between town and what's not really much the country anymore, but we do get a lot of people that come in, from the outer areas of town that don't have anywhere
hmm
else to go. So it makes it a little bit more exciting.
Yeah. And then for those dry eye patients, how many do you like typically see in a week?
Oh goodness. I mean, like most people every day, a lot.
Yeah. Okay.
Yeah.
All right. All right. Good to know. And how do you typically treat those dry eye patients?
Really kind of depends. I usually take inventory of what they've done so far, what like the
hmm
patient expectations are, because even though like a lot of times we'll see a lot of dry eye, signs on the patient, like if they're not symptomatic, they're usually not too motivated to do anything about it. So usually
hmm
I'll just lay the groundwork of this is what we're looking for. If you notice these symptoms, or if you want to be proactive, this is what we can do. And I mean, honestly, we do anything from just over the counter artificial tears. We recommend a lot of like warm compresses and lid hygiene in the office. And then we do a few plugs. We do some less than we used to in the past, some Restasis and Zydra. Um, but because of the cost, a lot of patients are deterred from doing that option too.
hmm Yeah. So we've seen amniotic membranes are very efficient at healing those dry eyes. In the
Mhm.
past, typically doctors only use the amniotic membranes in more severe cases, but right now, a lot of them are using that for more moderate cases.
Okay.
But that's definitely an option.
Yeah,
Yeah.
I have had some patients that have used it. So the previous practice I was at was more, what's what I'm looking for? Like corporate.
Okay.
Um, and so we didn't do quite as much medical. And so I have an ophthalmologist that we referred to that I had a few patients get the membranes put on, and then I would
hmm
see them back after. And yeah, I agree. I remember being very successful for them too.
Yeah. And what kind of patients was he treating them for?
So one was a really severe like SPK patient that just wasn't healing. She had some underlying health issues that was, she was like severely diabetic, hyperthyroid,
hmm
all those kinds of things. And then I had another patient that she had a really crazy cornea from having a bad shingles outbreak many years ago. And so they were just doing it to see if it could help at all with her scar tissue. She had a little bit of improvement. It wasn't great. Um, but she was kind of up for trying anything, and it did get a little bit better, which was, a step in the right direction.
Yeah. So after the membrane, you did see improvements.
Hmm.
Great. That's awesome. All right. Well, I'm just gonna go ahead and share my screen with you if you don't
Okay, cool.
mind. Yeah.
While she's doing that, Dr. Jordan, I would say
Yes.
for our clients, most of them use membranes for SPK and recurrent corneal erosion.
Okay.
hmm Yeah. So this is just our website. I don't know if you've had the chance to look at that, but we have a lot of resources on here that feel free. You can always go over. We do have some case studies on here, as well as some placement videos. As you said, you've seen some of them. Um, and then here is also a list of some ICD-10 codes. It's
Hmm.
a pretty extensive list. So if you see any others, patients that you usually treat, feel free to point them out to us. It's about 3. I can also send you this
I
after
was like,
this
that is a
call,
long
so you
list.
can. Yeah, it's pretty long. So these are just some indications for use.
Mhm.
Do you see maybe any other disease conditions that you do treat?
On here.
Mm-hmm.
I mean, I think we've seen most of it at some point.
Yeah.
Yeah, a lot of injury type situations too.
Mm-hmm. For sure. All right, cool. Yeah. So
Where are you located, Dr. Jordan? I'm sorry, Kelly. Where are you
Oh,
located?
we're in Hutto. It's a suburb of Austin, Texas,
Oh, okay.
like northeast Austin, I guess.
Okay.
Yeah.
were you guys getting those ice storms last week?
We did. We were closed Tuesday, Wednesday, Thursday
Oh
last week.
wow. Mhm.
Just because it constantly rained and refroze overnight, and our roads just aren't built for that kind of weather, so no one could get anywhere.
Yeah, for
So
sure.
I never lost power, which was good. Other people weren't so lucky.
Yeah, that's crazy.
The worst.
Mm-hmm. All right. Well, but yeah. So Apollo, we have a pretty simple procedure. It takes 3 steps. So you first numb that patient's eye, and then you put the membrane on a bandage contact lens, and then
Mhm.
you take that bandage contact lens and you put it on the surface of the eye. Do you have any experience with bandage contact lenses?
Yeah, we
Yeah.
use them pretty often.
All right, great. Yeah, so this procedure will be a walk in the park for you then. And then some of our clients do like to place that patient under a slit lamp and just make sure that placement is correct and in the right location.
Mhm.
Yeah, so we can go over maybe a placement video with you done by one of our doctors, Dr. Quint. So it's a pretty simple procedure. It takes about 2 minutes. There's just some tips and tricks we definitely like to go over with you in
Mhm.
case anything happens during the procedure. So as you can see, kind of all of our instruments and stuff are in pretty close proximity, just to make sure everything's organized. And that air dried membrane, once it hits the air or the moisture in the air, it can tend to fold up like a taco. So you just want to make sure that's kind of the last step in the procedure. He's taking it out of that packaging. And then you can dump out some of that excess liquid from the BCL just to make sure it's easier to place on that BCL, the membrane.
Mhm.
And then you will get a pair of forceps as well as a pack of black sponge cells just to make sure you can smooth that and get all those wrinkles out of those.
Mhm.
And you can tap out any air bubbles on that membrane. Yeah, so as you can see, it's pretty simple procedure. Takes about 2 minutes. Do you have any questions
Mhm.
about the placement?
No, that looks really similar to the video that I watched previously also.
Yeah, great. Yeah, well, I feel like you did have one more on yourself. We do recommend having at least like 4 or 5. Some of our clients do have 4 or 5 just in case they fumble that during the procedure and they have backups on
Mhm.
hand. Yeah. So,
What's the shelf life on one of them?
yeah, they're 5 years at room
Oh,
temperature,
cool.
so they don't need to be in a
Okay.
refrigerator or anything like that. Um, we don't use any harsh kind of gamma ray heat. Some of our competitors do, so it's
Mhm.
organically air dried. Yeah, just to make sure it retains all those healing properties and proteins of the amniotic membrane.
Mhm.
But yeah, do you know if you only have one left on the shelf?
I believe we only have one. She'll be in the office tomorrow, so I can double check. But I think the last time I looked, there was one in the
Okay.
drawer. Mhm.
And are you maybe thinking of having any places patients in mind in the future that you could use one on?
Yeah, I think honestly, it's just I've been scared to use it just because it's not my everyday that I reach for.
For sure.
But I need to just do it. It's really
Yeah,
what it boils
yeah,
down to.
definitely. Once you get practicing, I feel like the more you do, the more comfortable you get with the placements.
Mhm.
Yeah, I would just add a few comments, and Kelly is she's my mentee. She's doing a great job, Dr.
Mhm.
Jordan. So I'm really excited for how well she's doing and explaining the product and answering your questions. And So a couple quick points. So when you place the membrane on the ocular surface, you want a bandage contact lens that's 2 millimeters larger than in diameter than the
Okay.
membrane. So 12, if you're using a 12, you want to use a 14.
Yeah, so
Kaylee
not
can
like a
go over
9A or something like that.
Yep,
Yeah.
we
Okay.
recommend a couple. In fact, hold on here a second. Where's my little bag? We recommend if you have the Oasis, AccuView Oasis.
Uh-huh.
I don't know if you carry that one.
We do,
So,
yeah.
yep, let me turn it around. So we recommend that. And so as Kaylee was saying, just in terms of some of the features of Atlas, the 5-year shelf life, one of the things that's really nice about our product is you can place it either side down. So there's some competition out there that
Okay.
you have to make sure it's on the right side before as you put it in the BCL. So those are some of the things that make us different. And we air dry our membrane as opposed to treat it with harsh chemicals or store it in some sort of chemical solution as well that you would have to wash off. So just a few extra points to add to the great job that Kaylee's doing.
Very cool.
Yeah. So yeah, definitely no refrigeration. Definitely can store it on that shelf at room temperature.
And then I can't remember if it was a different company. Like I watched a couple of videos and I can't remember if it was exactly your product or not. But I know there's also a difference, and some people place the membrane on the eye and then the bandage lens over it. But I think that created some issues of flattening it out. So y'all always recommend putting it in the bandage contact lens and then putting them both on at the same time. Okay.
Correct. Just to make sure you can smooth out any wrinkles that
Cool.
may occur between the two.
Okay.
Yeah, and just as Kelly was saying, some of the tips and tricks, so to speak, in terms of you want to just expose the top of that membrane, as she showed you all the things in close proximity, and you just want to expose just the top very edge of the membrane and pull it out at the last second.
Got
And
it.
you want to make sure your forceps don't have any moisture on them, because then the membrane will want to stick. And that then you really got a little bit of a battle on your hands.
Gotcha.
So that's one of the kind of precautions. And you don't want to open it near a fan or an air vent because it's really flimsy
Okay.
in nature, as you know. So those are some of the things that Kelly is always gonna, stress to you. If you can know the date that patient's coming in, she can call you back and just say, "Hey, Dr. Jordan, just remember ABC."
Okay.
So will you do it by yourself, or will you do it with a tech in the room?
Either. I mean, I don't know. Because usually if I just like a regular bandage contact lens or their procedure, I'm usually just by myself. But for the first one, maybe I'll call in reinforcements.
Just to have someone in there, just to maybe hold the eyelids, and you'll see procedures done with a speculum. But I know most of the young doctors like yourself weren't trained to use speculums, probably. So we don't recommend using those because they could dislodge the membrane as you're removing it. So that's one extra concern that we try to eliminate in our technique, which Dr. Quint showed you. So just a few more points, and Kaylee can take it from here.
Yeah. Do you have any other questions for us, Dr. Jordan?
No, that's super helpful. I'm sure something will come up as I have a real life patient in front of me. But I feel like that's a really good overview.
Definitely, yeah. Well, I do know that you guys only have one left. So would you consider purchasing some more just so you have those on hand?
Definitely. So Dr. Thames is the owner, so it'll ultimately go through her, but anything that I know we need, we just give her feedback. So I can talk to her tomorrow when she's in the office and just give the recommendation. And I agree. I think one, just for patient availability, it's good, but as you said, backups are always nice in case something happens.
Yeah, for sure. Yeah, well, if you talk to Dr. Thames tomorrow, I can go ahead and contact you either tomorrow or the next day. Before we let you go, could I possibly grab your cell phone number just so it might be easier to communicate that way?
Yeah, definitely. Do you want me to just give it to you now?
Yeah, for sure.
It's 512 743 3893.
3893.
Mm-hmm.
All right, awesome, Dr. Jordan. If you don't have any other questions, I just want to thank you for hopping on the Zoom call today, and I was happy to go over everything with you.
Cool. Thank you so much.
Yeah, awesome.
Thanks, Dr.
Great.
Jordan.
Have a good afternoon.
Bye-bye. Yeah, you too. I'll be talking to you soon.
Sounds good.
Yeah, bye-bye.